Hi guys, so this lesson is all about small intestinal bacterial overgrowth. And this is for you if you have one, a positive test result from a Trio Smart breath test, a Quintron breath test, maybe from Genova. There's a variety of different breath tests that you can get nowadays. So if you have a positive test, one, or if we are highly suspicious that you have SIBO and you have a lot of the classic symptoms, and we've discussed this on your onboarding week. So stay tuned if you're interested in learning all about SIBO and small intestinal bacterial overgrowth. And I just love this slide because it shows these little critters, like all these things we can't really see going on in the gut. This is all microscopic, but it's really just showing us there's a deeper layer of microbes that are there. Again, they are not able to be seen, but when they get in the small intestine and they overgrow there, we tend to find that there's symptoms because there's not supposed to be lots of bacteria in the small intestine. We're only supposed to have bacteria in the large intestine. And if you see from this slide, our stomach has the least amount of bacteria, right? So very rarely can bacteria survive in the upper stomach from the pH of the stomach acid. And the small intestine has medium, a moderate amount of bacteria. So it has a little bit more than the stomach, but it has not nearly as much as the large intestine. So SIBO, what happens is we get too many bacteria in the small intestine here, and it goes over that recommended amount of about 10,000 bacteria per milliliter of fluid. So SIBO is an indication that there was a breakdown in something going on with your digestion, your motility, your metabolism, that this allowed the bacteria to overgrow where they shouldn't be. So we want that heavy bacterial content in the large intestine, but it's not supposed to be in the small intestine. And as a result, we get an increase in symptoms, bloating, fermentation of carbohydrates in the small intestine that we'll chat about. So you definitely can feel it. You definitely know something is off when there's bacteria overgrowing in the wrong spot. So I'm sure so many of you can share that when you've been to the GI doctor, your symptoms have been written off as IBS, and your doctor basically just says maybe try cutting some foods out from your diet, but there's really nothing else we can do. Maybe you'll get an antibiotic. Maybe you'll get, reflux medication, but there's typically not a solid answer from your doctor when it comes to IBS. And it's crazy because this is most of the time we find that 60% of IBS-D, which is IBS with diarrhea predominant, is SIBO, and 70% of IBS with constipation is EMO, which is basically SIBO, just categorized differently as an intestinal methanogen overgrowth. It's labeled as that because it's technically not bacteria. They're called methanogens. So it's kind of getting a different name in the clinical space as of now. But this is what we see so often is that SIBO is misdiagnosed, it's untreated, and it can exacerbate over time and just gradually get worse, and symptoms keep increasing without many answers. So I love being able to help you just figure this out and address this problem head on. So we have too much bacteria in the wrong place, right? So in the small intestine, then we get an increase in inflammation. We have this whole cascade. Then we get damage to our cells in the small intestine. We get then malabsorption of carbohydrates, fats, and protein, but especially carbohydrates, because that bacteria likes to feed on that food that we're ingesting, those carbohydrates. And then that increases the gas, right? And that gas has nowhere to go. Sometimes it goes up with reflux, sometimes it goes down with just bloating and distension. And that can affect constipation, diarrhea, depending on what types of gas is there, which we'll talk about. So it's this whole cascade of symptoms that really just stems from this bacteria being in the wrong location and overgrowing. And it doesn't always mean that the bacteria is bad or pathogenic. It just means it's in the wrong place. But dysbiosis, which is an imbalance of good and bad bacteria, that actually in the large intestine can trigger SIBO in the small intestine. So that does consist of pathogenic bacteria. And with newer emerging research, they're finding a lot of negative bacteria in SIBO cases, but it doesn't always have to be pathogenic bacteria. It could just be displaced good bacteria as well. So it's typically associated with a slow or damaged migrating motor complex. We see this a lot with emo and constipation. So it affects your motility. And this is why we do that polka dot stool test, because that will just give us a good, picture of your 24-hour motility. So we want to see if we can improve that with time if your motility is damaged. And it affects how food is digested and absorbed. It also increases our gut permeability, which is a whole other topic that you have a lesson on as well that you can watch later in the program. So these are some general SIBO symptoms. They are, as you can see, GI and non-GI. We have loose stools or constipation, depending on what type of gas you have present, what type of SIBO you have. We typically always see bloating or distension. We many times will see nausea because, like we said, that gas can go upward, and we have sluggish motility, so our food isn't moving quickly enough to basically leave the upper stomach, and that can cause nausea and reflux. We also have depression and anxiety because of that strong gut-brain connection that's going on, that our microbes are basically sending information up to our brain via the vagus nerve and via neurotransmitters, and that can affect our anxiety and depression. Skin problems because of that increase in gut permeability, that disruption in your metabolism, that will also increase skin problems from SIBO. And we also have weight gain or weight loss, joint pain, brain fog, fatigue. So as you can see, there's an array of symptoms. So sometimes it can be hard to pinpoint. But yeah, that's why, again, at doctor's appointments, it can be a little difficult to get a straight answer because some of the symptoms are kind of all over the place. Like we were saying before, it's widely underdiagnosed due to many GI doctors not really addressing the health of the microbiome. They're kind of only looking at structural issues of the GI tract. They're doing colonoscopies, endoscopies, right? They're not really looking into a deep dive of what's going on in the microbiome. That's more newer research in the past 10 years. And many of these GI doctors went to school 30, 40 years ago. And they're not looking at the current research. So there's also lack of widely available testing and insurance coverage. That SIBO test can be pretty expensive. And a lot of times that colonoscopy and endoscopy will come up normal. Therefore, you can pretty much be dismissed or just offered a medication that won't really address the root cause of the problem, an antidiarrheal, PPIs, right? So there is more emerging research than ever, though, with regard to the microbiome and SIBO. So there's hope for healing, no matter how much your symptoms have been dismissed or ignored. We're definitely getting to the bottom of this for you. And I just wanted to touch on the higher risk of IBS and SIBO for those of you, if you have an autoimmune disease like celiac, Crohn's, ulcerative colitis, there is a greater risk for IBS and SIBO, bacterial overgrowth, in the small intestine and the large intestine when you have an autoimmune issue. And I just wanted to point out as well, because I've seen this before where someone can go undiagnosed for many years with let's say they have celiac or Crohn's, and all that time they thought it was IBS or SIBO. So you always want to rule out more serious gut disease like IBD or celiac. You never want to just assume you have IBS. So going to a GI doctor is always recommended to rule out more serious disease. I even like using fecal calprotectin. I recommend that at your GI doctor if you're not ready for a colonoscopy. It's a great screening tool for IBD. You also have CRP levels, which also test inflammation. Then we have endoscopy and celiac blood markers that can rule out celiac disease. So I typically recommend that. And again, colonoscopy will assess for IBD lower down in the GI tract, but it is possible to have both IBD and then layered in with IBS and SIBO. And I have helped these clients before. It can be tricky, but we can definitely see some symptom relief and eradication of SIBO. So here are my little fun depictions of what the small intestine should look like. On the left, we should see this running river of water. Everything's flowing really nicely. You're not getting any stagnant food particles or bacteria. And then on the right side, when we have just less motility going on, we have a kind of what becomes a babbling brook, right? So things are moving a little too slow. Bacteria start to ferment your food. What happens is then that bacterial fermentation slows things down even more. So then your food is sitting there longer being fermented. You get constipated, you get bloated, you get gas. So we want our gut to look like the video on the left where things are moving quickly. So if your gut is looking like it's on the right, you're having sluggish gut motility with SIBO, then our goal is to, one, stimulate that motility again and figure out why that slowed down in the first place. And here we have a distribution of bacteria in the gut, just showing you the difference between a normal flora and a flora in the small intestine that is overgrown with bacteria. So there are 3 different gases that come up positive on a breath test for SIBO. We have 1, methane, which we know we call intestinal methanogen overgrowth, 2, hydrogen, and 3, hydrogen sulfide, which is a more recently discovered gas that has for many years not been tested on a breath test. Only we would see hydrogen and methane. So now the Trio Smart breath test tests for hydrogen sulfide, which is great. So we'll talk a little bit more about these. And here's just a little depiction of how SIBO actually produces gas. So carbohydrates that we eat many times from FODMAPs feed our bacterial overgrowth called SIBO. The SIBO then produces hydrogen, and that hydrogen actually feeds our archaea, and then archaea then produce methane. So this is more like the indirect version of the methane dominant progression, but as we can see, a hydrogen overgrowth will feed more methane, and then we get more bloating, constipation, and altered stools as well. So the ideal test for SIBO would be a jejunal aspirate, but we don't really do this because that basically means like testing the fluid itself in the lumen, intestinal lumen, and that's not really very, well versed in the clinical practice because it's just not feasible. So then we usually do breath testing because this is less invasive. It's easier to do, obviously, instead of getting a biopsy basically of the intestinal fluid. So we have methane dominant, like we said, that's more associated with bloating, distension, slowing bowel transit, influencing constipation, and sometimes we can see breakthrough diarrhea with methane. Then we have hydrogen, which is more diarrhea prominent, still have bloating, and many times we can see some fat malabsorption, which is called steatorrhea. And we see fat in the stools at times. It can appear thick, white, like foaminess on top of the stool, or the stool can turn yellow or green. And the difference between SIBO and EMO has again been pretty recently diversified. So SIBO would be considered more hydrogen producing, associated with diarrhea, and EMO would be associated with constipation, upper stomach, bloating, reflux, and gas, nausea, and also they're both diagnosed with breath tests. And like we said before, hydrogen sulfide is a newly discovered gas. It may look like a flat line on a regular methane hydrogen breath test, but now they are using a Trio Smart breath test, which will then look for all 3 gases. But in the past, it usually was recognized by symptoms with having like a rotten egg smelling gas, definitely bloating, could be diarrhea or constipation, abdominal pain, and the visceral pain that comes with SIBO, which basically means you have a hypersensitivity to pain when you have SIBO in your gut. So you're feeling the gas and the gas pains a little bit more than the average person would feel gas. You can also have sensory symptoms with hydrogen sulfide SIBO, like intolerance to noise, some tingling in the extremities. So other factors can be felt in the body as opposed to just in the gut. And many times people are told that they're SIBO free, but they still have symptoms. Because of that, the fact that breath tests in the past only tested for hydrogen and methane, but now on these new tests, people's SIBO, symptoms are being validated, that's not a word, validated because of that third gas being tested. And as you can see, there are many barriers to SIBO testing. So there are times when SIBO can be treated without a formal diagnosis because there can be barriers such as testing availability, lack of insurance coverage, the testing can be expensive, and there sometimes can be a big lag time for when you can see your GI doctor to when we meet together as well. And it's very, again, there's out-of-pocket costs for the expense of the test. So here's just a little bit more pathophysiology about bacterial overgrowth. We have basically the bacteria are exposed to our food prematurely. So that basically just means, again, that they're too high up in the digestive tract. Then the bacteria then ferment our food, they consume the food, it causes fermentation, causes gas and GI symptoms. And that food then feeds that bacteria and creates this negative cycle where the bacteria continue to thrive and replicate because they're eating your food, basically, that you're supposed to be getting. Then you're not absorbing your food well enough. And then your motility is declining because of that bacterial fermentation. So it's this whole host of a negative cycle that's perpetuated once the bacterial overgrowth begins. We also have here on the right side, we can see that there's fat malabsorption. So then that could lead to deficiencies in fat soluble vitamins like vitamin A, D, E, omega-3 fatty acids. We have bile acid deconjugation. So basically that just means that bacteria don't like bile. So they basically denature it. And then you have a harder time digesting your fats. We also have increased inflammatory cytokines, which basically means that we have a cascade of an inflammatory reaction going on. We have a damage to the brush border. You see on the bottom right here, which basically means the villi in your intestine get actually damaged. And they used to think that there was no damage to the intestines. And now they're finding out with SIBO, it's not just the microbes, it's actually having damage to the cells, which is the brush border at that gut lining. We also then have malabsorption of carbohydrates, those disaccharides, due to the blunted villi in the intestines, and then an increase in intestinal permeability that can lead to those widespread symptoms in the body, like the joint pain, the fatigue, all those non-GI symptoms. Then we have, again, just going back on the left here, we have hydrogen and methane gas depending on the case. We have different symptoms depending on that. And all that is due to that fermentation of unabsorbed carbs, then feeding that bacterial growth and that negative cycle. So what happens when you have maybe the gold standard SIBO test, the Trio Smart Breath test with all three gases, you're negative, but you still have classic SIBO symptoms, and you have a few other fungal, interesting symptoms that are related to fungal overgrowth. Typically, this is called SIFO, or small intestinal fungal overgrowth, because it doesn't just have to be bacteria that are there multiplying. It can be fungus as well. And most of the time, this is candida. So usually I would see here, we would have a frequent UTI cases, frequent yeast infections, a lot of antibiotic history and usage there, a low tolerance to sugar and carbohydrates, joint pain, stiffness, maybe some overgrowth of bacteria in the mouth, which is called oral thrush, and that would look like a white tongue. And sinus infections, all these things can actually point to SIFO, and that there's currently no test available for SIFO. So that's something I usually assess based on symptoms. So we'll definitely be talking about that if this is your case. Let's talk about some other disease processes and chronic diseases that go hand in hand with SIBO. So as you can see here, there are many chronic health conditions that coincide with SIBO. It's kind of like a chicken or the egg thing, which came first. They're not really sure. Sometimes SIBO can come first and influence the disease manifestation. Sometimes these diseases are present and SIBO can develop coincidentally. And they kind of go hand in hand with each other. So we have obviously IBS. We know that falls into a big category with SIBO, rosacea, diverticulosis, because again, food is sitting stagnant and then getting fermented. Crohn's disease, we said before how autoimmunity will increase your risk of SIBO, gastroparesis with diabetes because you're getting a sluggish motility there as well and things slow down in the GI tract. Hypothyroidism, I definitely see that a lot because hypothyroidism can reduce your gut motility, and that slowing down can influence SIBO overgrowth. Chronic PPI use because that lowers your stomach acid and your ability to digest foods, and it allows bacteria to overgrow when they get to the small intestine because they're not killed off very well. So definitely check out the stomach acid lesson because we'll talk a lot about that in there. And things like diabetes, like I said before, cirrhosis, and smoking. So can SIBO be treated with diet? Unfortunately not. As a dietitian, I would love, food first always, but the only way SIBO can be treated with diet is an elemental diet, which is very unappealing and very hard to actually consume. And I've tasted it. It's really, really difficult to do that for weeks on end, and it's an all liquid diet. So I don't recommend that. There's much easier ways to go about healing your SIBO with the assistance of your diet and your nutrition. So just want to point out that you cannot cure SIBO alone with a low carb diet, with a low FODMAP diet. It can improve symptoms, which is why I like to use a low FODMAP diet temporarily, but it can give you false hope. If let's say you go low FODMAP and you go grain free, you will feel better because you're reducing the food that you're giving to those bacteria, but it does not cure it, because when you start eating those foods again, it's just going to come back. So you need to be doing a temporary, let's say, low FODMAP diet in conjunction with addressing root causes. Because if you're not healing it at the same time, that diet is going to be a temporary band-aid, and your symptoms are just going to come back. It's also really, really important going through this process that you're really thinking about chewing your food well during this SIBO healing, because the food needs to be broken down very, very well as it's traveling from the stomach to the small intestine. Because if you have these large particles of food that are not broken down, you're going to get higher fermentation of bacteria on those food particles. So chewing your food is very important. Just wanted to touch on the types of microbes that have been found to be present in the small intestine with SIBO. So we have Klebsiella, Shigella, E. coli, Enterococcus. So they tend to be some of the nastier ones. I'm not going to lie. They tend to be some more pathogenic bacteria. And it depends again on what these microbes have preference for how you're going to feel. So some of them have a preference for metabolizing bile, like I said before, which can lead to reduced bile available for your digestive function. That can lead to more bowel urgency, fat malabsorption, maybe changes in stool color. And then some of the bacteria prefer to metabolize mostly carbs. So like we were talking about in both senses, then they metabolize those carbs into short chain fatty acids, which in the large intestine, those short chain fatty acids are very good for you. But in the small intestine, that will cause more bloating, constipation, and symptoms. So just wanted to touch on that again. Now let's get into root causes, because these specific root causes are only specific to you. So that's why we have an individualized plan for you to tackle, because no two cases of SIBO are alike. And SIBO in itself is a symptom of dysfunction. It's not just the only problem we need to tackle. We need to know why this happened, why this digestive breakdown occurred in order to truly heal. Because if you just focus on killing those bacteria, it's going to come right back, because the dysfunction of why the slowness happened, why the gut became sluggish, all that needs to be addressed in order for it to not come back, to prevent relapse. So these are just some causes we can generalize. So like taking reflux medication, again, because that lowers the stomach acid. Birth control. I've seen birth control play a role in a lot of SIBO cases because it influences the gut motility. It also reduces gallbladder function, which we need. So because we know that bile is really like an antimicrobial. So once we reduce that bile flow with birth control, then we allow bacteria to grow. Acute gastroenteritis, so like a food poisoning event or getting a stomach bug, that can trigger your gut motility to actually get very damaged, and that can cause that slowness as well. We have low stomach acid, again, migrating motor complex, which is affected by the gastroenteritis and hypothyroidism. Any nutritional deficiencies and some hormonal imbalances as well. Then we have like a high carb diet over a very long period of time that can influence a bacterial overgrowth. Not super common, but more kind of the other ones. But I have seen also high carbohydrate, high sugar intake impact SIBO development as well. We also have low digestive enzyme output. That can even be something as simple as that can cause a SIBO overgrowth, because we need adequate pancreatic enzymes. We need adequate stomach acid to really digest our food really well. We definitely see history of frequent antibiotic use throughout all ages. So let's say you had a lot as a baby, or growing up, you had a lot of antibiotics for sinus infections or UTIs. I see a lot of antibiotic use that influences SIBO development. Chronic stress, don't underrate how much stress can impact your health. Chronic stress is a big trigger of SIBO in combination with other factors. Like we said before, birth control, even stealth infections like Lyme or Epstein-Barr. So it can't hurt to have your GI or normal doctor, your primary care doctor, test for Lyme or Epstein-Barr, just to rule that out. Then we have abdominal adhesions from any previous surgeries that were in the stomach area, like a C-section, Crohn's disease as well. So again, autoimmunity and dysbiosis, like we said, in the large intestine can then influence what's going on up top. Then we said food poisoning before. We have hypothyroidism because that reduces our motility. So it's important to test for a full thyroid panel, and you could check that out in your recommended lab work PDF. Then we have a gut-brain axis dysfunction as well. Endometriosis, I see as a big trigger of SIBO. Gallbladder removal. Up to 50% of people with their gallbladder removed end up getting SIBO, scleroderma, and rosacea. So as you can see, there's a lot of different things that can contribute. Just a few more here. Microbial imbalances, like even parasites in the large intestine. So sometimes a microbiome test, it can't really tell you if there's SIBO up in the small intestine, but it can give you an idea if there's dysbiosis or parasites, E. coli in the large intestines, you have a higher chance of having SIBO in the small intestines. Then we know food reactions as well, histamine intolerance, salicylates, oxalates, sulfur, those can play a role. We'll talk a little bit more about histamines in a few slides. Then we have just general inflammation, and we said stealth infections like Lyme, and we have toxic overload from the liver. So we have a whole other presentation as well about liver health and how we can support liver for the gut health. So just checking back in, we have these common digestive points that we really need to optimize in order for SIBO to fully heal and to make sure all these points are working properly throughout your GI tract so you're going to feel the best that you can. So stomach acid, we've talked about how that's very important to maintain that acidic environment to kill bacteria before they get to the small intestine. How important that bile is because it's antimicrobial, protects against our bad bugs. That MMC is very important because those are those muscular waves that help our motility move along. So that's a point, again, that we very much see with SIBO that can be damaged, that influences that development. We'll have a whole session as well about gut permeability and the immune system in the gut and how we can reinforce that to deter any overgrowth coming back. And the ileocecal valve is also the last and final very important checkpoint. It's basically a one-way valve that prevents the flow of bacteria from moving back up into the small intestine. That's not something we can really control, but I have seen that influence a bacterial overgrowth. And so, how does SIBO affect our nutrition and our nutrient status and our lab work? So, these are some signs I see often that show that you can't really diagnose with this, but it can help you put the pieces of the puzzle together that show that SIBO is present. So, we have low B12, it's actually consumed by the bacteria in your small intestine. And then it's inhibited to be absorbed by those organisms that are in the terminal ileum, which is the lowest part of your small intestine. We usually see low ferritin, we usually see high bilirubin, high folate at times, possibly low B vitamins like thiamine and niacin, and then we see those reduced absorption of fat-soluble vitamins A, D, E, and K. We usually see higher liver enzymes, sometimes not, because the liver is working a little bit harder to kind of get those microbes out of your gut. And then we said before, we have the malabsorption of carbs and malabsorption of fat as well. Just want to hone in again on motility because we know SIBO, especially methanogen overgrowth, is associated with constipation. So that polka dot stool test will measure your transit time. If you didn't do that already, I highly recommend doing that and filling out your form for that. And we know that slower gut motility is a cause and an effect of SIBO. So we get that negative cycle of basically, I'll show you here on this next slide, how our gut motility is slowed by a factor that we've talked about, whether gastroenteritis, hypothyroidism. We'll uncover that together as to why that happened. But then that causes the food to linger in the small intestine. Carbs then get fermented by bacteria that are not cleared out. Then that fermentation further increases methane gas, which then further slows the gut motility, and you get bloating and constipation. And this cycle just continues on and on until that SIBO is addressed and the root cause of why the bacteria and the food particles slowed down is addressed. Just going back one slide here because it's important. So these are some things in general that can inhibit that MMC activity, which basically means things that can slow down your gut from basically your transit time. It can slow your transit time. It slows things moving in your small intestine, kind of creating that babbling brook instead of the river. So just check these out. Definitely things like a weakened vagus nerve, blood sugar swings, thyroid dysfunction, like we said, chewing gum, snacking, and grazing because you're not giving your gut enough time between meals to really slow down and just digest your food particles. The MMC is only working when we're not eating. That's important. So between meals is when that MMC is actually sweeping things out and allowing those food particles to leave and move on into the large intestine. So when we're snacking all the time, we're turning off that MMC and things are just moving a lot slower. So those short fasting periods between meals are really great, as well as a long overnight fast, about 12 to 14 hours between dinner and breakfast. And like I said a few slides ago, there is now evidence that there is intestinal damage with SIBO, much like with celiac disease or much like with an autoimmune disease in the gut. And that was never really known before until the past few years. So this villi damage affects our digestion, affects our absorption of nutrients. It affects our digestive enzyme capacity because villi, the tops of the villi, I'll show you this next slide here. The tops of the villi on these little particles in the small intestine are where our digestive enzymes are located. They're where basically our DAO enzymes are, which break down histamine, which is important because histamine can raise our inflammation in the body as well. So these villi are very important. And when they're blunted, you're not really getting adequate digestion because also it can actually impact the way we absorb medications. So let's say you're taking thyroid medications, but you have blunted villi from SIBO, your thyroid medication is not going to be absorbed and utilized as well as it could be if your villi were very healthy. So it's important to get these villi nice and healthy by eradicating SIBO overgrowth. And sometimes digestive enzymes can be very helpful, and this may be part of your treatment plan, maybe not, but it's very individualized per person. So it can initially help for symptom improvement and improvement in the breakdown of the food particles before they get to your small intestine. And it's important just to touch on histamine. You and I will talk about this if I believe histamine is a problem for you. But histamine is important because SIBO can cause our histamine bucket to kind of overflow in the GI tract because there's less DAO enzyme that breaks down histamine on those villi, if you remember what I was just talking about. So because of that damaged villi, our body is not able to handle the excess histamine that is produced in the gut. And then the histamine bucket of your body can overflow then into the rest of the body. Then you could see issues like sinuses, sinus problems, itchy skin, rashes, watery eyes, allergies, all these overly, these histamine problems where you just have too much histamine in the body, and that's influenced directly by what's going on in the gut. So we'll chat if I think this is appropriate for you, if you may need a DAO enzyme supplement temporarily to reduce the histamine production and reduce the inflammation. So you may just be thinking, well, why can't I just take an antibiotic and just kill everything? Because it's really not that simple, and I wish it was. The first line of defense, I would say, in the conventional space is rifaximin for SIBO, which it does do a good job of killing the bacteria there. But it does not address the root causes. And typically we see things and we see that SIBO overgrowth come back a lot more strongly. It does not have a good success rate of keeping SIBO away for good. So it is, with the benefits of rifaximin, it's a great antibiotic that generally stays localized to the small intestine. So it's not really killing a lot of bacteria in your large intestine, which is good, but it also does not affect SIFO or fungal overgrowth. And typically these are pretty much going hand in hand. We have bacteria, we have fungi. So a lot of times we don't see benefits from rifaximin because we still have fungi overgrown in the gut, if you're getting my drift. So that's really important. So I'll talk about my preferred method that doesn't have a high relapse rate, and it addresses all fungi, parasites, viruses. So my specialty is using herbal antimicrobials because they have more positive outcomes compared to rifaximin in research. I've linked a study here. There's more and more research coming out about herbal support, and it's just a little bit more of a natural route. We have less damage overall to our gut flora. It's going to have it's going to help also improve the large intestinal flora. And the specific regimen I use will vary based on your specific type of SIBO, your symptoms. There's a few different regimens that I use, so that'll be individualized to you. But these herbal antimicrobials, they cover bacteria, protozoa, methanogens, viruses, fungi, and parasites, where rifaximin only targets bacteria and can actually worsen a fungal growth because it's killing all those bacteria, allowing the fungi to then take over and grow more. So that's why I like herbal antimicrobials. And it's just a little bit more gentle on your whole gut. You're taking it over a longer period of time as opposed to an antibiotic that's, a 7 to 10 day span. You're taking it over a few months, so it's a more gentle approach. We also just want to make sure that you're not taking herbal antibiotics either for too long, because over a long period of time, like 4 or 5 months, they can cause the killing of some good bacteria. So just to know, it's not something you want to be taking forever. It still should be a short period of time where these herbal antimicrobials are used. There are specific types of probiotics that I recommend throughout the healing journey, and these are going to be individualized to you as well. There are specific strains and types of probiotics that are recommended at different stages of the healing process based on what you can tolerate at the time, depending on your symptoms as well. But my favorite usually to start with is S. boulardii. It's highly utilized in clinical practice. I'll talk about it in the next slide, but it's one of my go-tos for improving your gut flora. It kind of assists the herbal antimicrobial in that aspect. And then we move on to more spore-based broad spectrum probiotics. And I like spore-based because they actually can get in a little bit deeper into the intestines. They have a little bit stronger of a survivability as opposed to regular probiotics. They do not need to be refrigerated. That is, a myth now, because a lot of them are very stable on the shelf. So you don't need to have a refrigerated probiotic, but we will work together to determine which probiotics are right for you and at which point of the program. And S. boulardii, again, like I was saying, is one of my favorites to start with because it helps regulate the microbial homeostasis in the entire gut. It's also working in the large intestines, working in the small intestine to, again, assist your antimicrobial in improving that overgrowth. It helps resolve diarrhea and loose stools. It helps prevent bacteria and fungi from adhering to the cell walls in your gut. It helps break down biofilm, which is basically biofilms kind of are like stubborn bacteria that kind of protect themselves in literally what you can think of like a film, which is kind of gross, but they kind of put a barrier film up. So this S. boulardii helps to kind of break through that biofilm and helps get rid of the overgrowth that much quicker. And it reduces gut inflammation. So that is my topic on small intestinal bacterial overgrowth. Please let me know if you have any questions, and I'm excited to hear about how you're doing. Talk to you soon.